Many people are suffering from the acid reflux, which is very common. So it can be usually because of the weak sphincter in the stomach area, which is there's an opening and then closing area. So once it gets weak, the acid comes back to your stomach, which is reflux. That way it causes the heartburn and chest pain, and you feel the acid reflux. It can be worse by eating spicy food, caffeinated food, or chocolate. And then if you eat late night after like 6-7 p.m. and then you go back to like the sleep, to the bed right away, then it can cause more acid reflux. If you are suffering from the chronically or acutely the acid reflux, so if you come to our office and then we'll assess you and consult you, and then we'll order the endoscopy. So endoscopy with the Bravo and manometry. With the Bravo, we can measure how acidic your stomach is, so that way we can see how severe your acid reflux it is. And manometry, which is how strong of contraction of your muscle in here. So sometimes if acid reflux is chronically going on, then it can damage your throat. So which can cause difficult swallowing, and then the pain, throat pain, and you feel like a lump in your throat. That way we can check how strong it is. So once you come to our office, we'll assess you, and then we'll ask questions and consult you, and then we'll order the EGD with the Bravo and manometry, and then we'll see what's going on. Many patients are on acid reflux medicine like over-the-counter, PPI, Pepcid, omeprazole, pantoprazole. So it can control your acid reflux for a certain amount of time, but if you're on for a long time, then actually it can cause the rebound acid reflux. So usually the medicine regimen is controlling your acid reflux. It's not actually treating your acid reflux. Usually our patients, they've been on over-the-counter, Tums, Pepcid, Zantac, pantoprazole, omeprazole for such a long time, and it's not controlled, and then they're coming to see us for the ultimate and then permanent getting fixed. So if the patients who are suffering beyond the medicine for a long time, it's not helping, then please come to see us, and then we can help you.